Hello, and thank you everybody for joining us this afternoon. We are tracking our first confirmed case of monkeypox here in Connecticut. And to provide some insight on that, we have Dr. Ulysses Wu from Hartford Healthcare joining us right now, just to kind of tell us what to expect as this first case, confirmed case, is being reported, and what we can expect as the months go on. So, Doctor, thank you very much for joining us. And I guess the first question that I have is going to be around panic, right? Because, when something is so foreign and so new, it would be easy to panic. And why should we not panic when we hear about the first confirmed case of monkeypox?
So we shouldn't panic because it has very little pandemic potential. What we are doing is we are facing a new disease on the backdrop of the previous disease, which is COVID, which has a lot of pandemic potential and has infected a lot of people. Now, I don't want to state that monkeypox is not infective, because it certainly is. That's certainly how we get it from person to person. And it's actually a misnomer. It doesn't actually come from monkeys. Monkeys can actually get infected. Theoretically, you could get infected from a monkey, but it's actually more like a rodent pox, because that's actually where you get it. So it has infective potential, but amongst the backdrop of COVID, its infectivity potential is much less than something such as COVID. But again, that's not to say that it's not infective. And there are certain patient populations that you certainly have to take precautions because of its mode of spread.
Got it. So, let's just kind of break it down from the very basic. What is monkeypox?
So it's a virus, again, a misnomer, not really associated with monkeys. It was isolated from a colony of monkeys, so monkeys can get infected, but again, mostly spread through bodily fluids, scratches, bites of possibly rodents, and that's actually how it originally spreads. Prior to this outbreak, in non-African countries, usually seen in travelers, this virus. We've seen cases, but not to this extent.
Got it. So I guess, when we're talking about getting it and how contagious this is, first of all, how contagious is it?
So it's contagious, but not contagious when you compare it amongst the backdrop of something such as COVID. And so you take a situation such as COVID, where it can be spread through a respiratory route. So you don't need to be in contact. This is very different. You need to have contact spread. You have to have contact, and contact usually happens through bodily fluids or through the infected pox like itself, which is very different from something as COVID. So its infectivity potential, although infective, does usually require contact. Now, could it be spread through what we call infected fomites? So there are cases of linens, sheets, things like that, where it may have spread, but really its primary mode of contact spread is through contact.
All right, so when we're talking about contact, give us some examples. Is like a handshake a good example of contact? Are we talking about even closer contact? Maybe sharing a drink, sharing a fork, things like that?
Well, anything is possible, but to be honest with you, it really has to be close contact. And so this current outbreak seems to be mostly sexually spread from that standpoint. And so that's why we always talk about taking the precautions to make sure that it isn't spread. But I'm not going to say none of those other modes are really possible, but in reality, it does have to be close contact with the lesions itself.
Got it. And so I guess just to underscore the point, COVID, we're so kind of hyped up on COVID over the last 2 years. We're very cognizant about that. This is not going to be something that's going to be spread through droplets or aerosols, anything like that.
For the most part, no, that is not something that we need to really worry about.
All right,
from a respiratory dissemination.
Now, when we take a look at some of the pictures of monkeypox and we see the lesions on hands, are those the only symptoms? What's another symptom that we could be seeing that's kind of a telltale sign of monkeypox?
Well, there's the traditional symptoms of what we would call a prodrome. So you certainly have kind of like a flu-like illness, believe it or not. You feel lousy, you may have headache, you may feel achy, you may feel tired, you may feel fatigued. But I will say that with this current outbreak, those symptoms are really not as common. But what is pathognomonic, and what do I mean by that? What usually always has to be present is the rash itself. Now, the pictures, if you Google it, you see it all over their body, on their arms, hands, legs, feet, so and so on. But with this current outbreak, because of its sexual potential in terms of transmission, seems to be starting at least in the genital region. It may spread to other parts of the body, but a lot of these cases are isolated to the genital region. So it's very different from previous monkeypox cases.
Is it painful?
Yes, it can be painful, depending on really where it infects you. I mean, if you think of something such as chickenpox, well, chickenpox certainly more itchy, could produce some pain. We certainly haven't seen smallpox since the advent of the smallpox vaccination, but it can be painful depending on the area that infects, at the very least, incredibly irritating.
So when, the time frame of all of this, after exposure, when would we see the symptoms, or in this case, the rash, to manifest itself?
Yeah, usually after exposure, anywhere from 4 to 21 days, though the majority of the cases probably occur between 5 to 13 days after exposure.
Got it. So how long does a bout with the monkeypox last?
So it lasts several weeks. We would expect something to last at least 21 days. And really, its infectivity is still possible up to that point. And so we want to make sure that the lesions have really, for the most part, resolved before we consider somebody not infectious.
And like in the beginning stages of COVID, somebody who had a confirmed case, they were asked to isolate, quarantine for minimum 2 weeks, right? What's the protocol here when it comes to monkeypox?
So we certainly have to confirm that there is a disease, but we would certainly ask somebody to remove themselves from close contact from any individuals until the infectivity period is over. I'm not going to say it's much longer, but it is longer than COVID, which, you're really expected to quarantine for 10 days, or I should say isolate yourself for 10 days. With monkeypox, you may not necessarily need to put yourself into complete isolation, but you should certainly avoid all close contact until your infectivity period is over.
And for somebody who is, I guess in this case of the first confirmed patient, what is he going to be experiencing in terms of treatment right now? How are they going to be attacking this?
So they're going to probably be, depending on what stage he is in, but they're going to be attacking it from a variety of standpoints. They're going to have supportive treatment. So that's what we mean to alleviate the symptoms, do our best to support what they may be feeling at that point. But then there's a variety of what we call vaccinations, as well as antivirals that will probably be given to the patient.
Got it. And so I guess, in terms for the rest of us, right, the general public, the advice for the COVID vaccine was get it. No matter your age, no matter your health condition, get the vaccine. When it comes to this monkeypox vaccine, you were talking about vaccinations being out there. Who should be getting that?
So that is part of our mission, to make sure that we target the right people that may be at risk for developing this monkeypox, because right now, it is believed to be mostly sexually spread at this point. So we are targeting groups to make sure that the education is at least provided to know that if they do develop symptoms, that there can be treatments, that it needs to be diagnosed, but also vaccination across the United States is being targeted to certain groups to make sure that it will help protect them against monkeypox.
Can we share what those groups are right now, or is it still kind of too early for that?
No, it's not too early. The only reason I hesitate at all is because right now it is what we would experience in the men who have sex with men patient population. But the only reason I hesitate is because you don't have to be a man who has sex with men to develop this disease. It can also be spread heterosexually and through close contact, and not even sexually at all. So I don't want to certainly stigmatize one group. But yes, there is this one group that certainly outreach is being provided, but anybody can get this. And I know how this can, in terms of the information, how it spreads, that it may be limited and stigmatized to one group, and that certainly is not the case at all.
Got it. Got it. Now, I want to ask you about, what you foresee monkeypox being as we kind of go through the rest of the summer, through the rest of the year. How do you think that this is going to evolve, especially here in Connecticut?
Well, I think what we're going to see is we're going to see more cases, and that's why the public education and the public health education is very important, to make people aware that this certainly is out there, and so people can take the proper precautions, whether it be through safer sex, whether it be through just the simple history and awareness with patient populations, to make sure that we don't continue the spread. The amount of monkeypox that has been spread globally is much more than we've seen in previous cases, numbering in the thousands. And unfortunately, although this seems to be less lethal, there has been at least one death associated with this. And so what you would hope to expect is that through public health and through public education measures, that this will start to decline at this point. But without that, without taking the proper precautions, you can certainly still expect to see a rise in cases.
Perfect. Doctor, thank you so much for joining us. Is there anything else that you'd like to add?
Yeah, I think right now, I don't want people to panic, which is what you opened up with. It certainly has a potential to spread, but its mode of spread is much, much different from something such as we would say with COVID, influenza, those respiratory diseases. And because of that, we can take precautions. If you think that you have been in contact or that you have been exposed, you certainly should seek a health provider's, you should seek health, I guess what I'm trying to say is you should seek a health provider's expertise, because there are a lot of things that certainly could mimic monkeypox that may not necessarily be monkeypox itself, including other STDs. People have gotten chickenpox mixed up. So there's a lot of different things that could mimic this that are not necessarily monkeypox. A lot of this is really based off of your history, your sexual exposure. Traditionally has been travel related. And so travel history certainly would also be taken into account. These are all the things that a health expert would hopefully ask and hopefully try to figure out whether or not you are at high risk or you have been exposed.
Perfect. Dr. Ulysses Wu, thank you very much for making time for us this afternoon. You at home, thank you for making time for us as well. We'll see you guys later.
Thank you for having me.